What is radiotherapy like? In the rest of the video, I'm going to explain what it's like to have radiotherapy. Um, I've had two courses of different kinds of radiotherapy. Um, there are many different kinds. Broadly, they fit into two categories. There's particle-based radiotherapies like proton beam therapy, boron neutron capture therapy. And then there's the gamma ray therapies, or sometimes called X-ray based therapies, like the old-fashioned Linac therapy, or like cyberknife, tomotherapy, or view ray. Yeah, so broadly, two kinds. The side effects vary a lot. In my case, I didn't have any side effects from my chemotherapy, from my radiotherapy. I had a lot of side effects from chemotherapy, but from the radiotherapy, I didn't have side effects. Although I should qualify that because, I didn't experience side effects, but the radiotherapy still damaged my body because that's one of the consequences of radiotherapy. So, radiotherapy causes bone marrow suppression. So it inhibits your body's ability to make white blood cells, red blood cells, damages the immune system, so immune suppression. Depending on the type and how much you have, you could get kind of burning on the skin. So you may be given skin creams to prevent that and skin creams to deal with that. Your radiotherapy may just be a few sessions, or it may be many, many, many sessions. When I had proton beam therapy, it was 40 sessions spread over 8 weeks. So Monday to Friday, had a session every day. The session itself only took, I think, 15 minutes altogether, of which maybe, I don't know, 12 minutes of that or something is positioning you, and then a couple of minutes doing the therapy itself. So typically, before you start your course of radiotherapy, you may have some kind of device made for you to keep you still. In most famous are the various devices for like holding your head still if you're having radiotherapy on the head or neck. In the case of proton beam therapy, we had a device called a backlock, that was like I think it was like some kind of rigid foam bed cover essentially. So it's put on top of the treatment table, and it was molded to the shape of your body and kept you still. A similar thing, yeah, for tomotherapy. There was before I had my radiotherapy, when I had tomotherapy, I went to the treatment place a few weeks before, and they made me lie on the table, but I was like lying on a mattress made out of sand or something, and they moved my body around until I was in the right position, and they sucked all the air out of this mattress, and I guess they probably wasn't really sand, but some kind of chemical that they could make rigid. So they then had this rigid contoured bit of bed to keep my body still. Some radiotherapy, there'll be like a targeting device that is scanner based. So with like tomotherapy, there's an X-ray machine essentially built into the radiotherapy machine. So you're going to turn up for your session, they'll put you on the table, you lie there while they move you around a bit, and then essentially the machine will sort of x-ray you and check it you're in the right position. The staff might come and move you a tiny bit. The machine will align itself based on the treatment plan, and then it will zap you with the radiation, and you won't be aware of anything happening. And you may have many of these sessions. And yeah, so in the case of tomotherapy, I think I had 20, no, maybe 25 sessions for the liver. Sometimes you can have radiotherapy in 2 places or even 3 places in the same treatment session. They may have to reposition you during that treatment session with a CyberKnife, which is radiotherapy on a robotic arm. The machine can reposition itself a lot, so you often don't need to be repositioned at all. So yeah, one issue, maybe surprising, is you might be in quite an uncomfortable position during the radiotherapy. So I had radiotherapy for my right lung, had to have my hands up behind my head in an odd position. And of course you want to be really still, because if you move too much then they'll have to come and reposition you and interrupt the session and stuff. So if you have like very tight shoulders, or if you've of course had some surgery, maybe breast cancer, or you've had part of your lung removed, maybe a wedge resection or lobotomy, you might have pain and issues with that. So it's worth talking to the radiologist about the position you're going to be in, and then maybe ask to see a physiotherapist who will give you some maybe exercises you can do in the days or potentially even weeks before the radiotherapy, so that position is more comfortable. Yeah, so I hope that helped explain a bit about what radiotherapy is like. As with many cancer treatments, if it works, it's awesome. And yeah, in my case, the proton beam therapy was unsuccessful, but was completely painless except for the incredible financial toxicity. But the tomotherapy I had for liver and lung and para-aortic lymph nodes was very successful. So I'm incredibly pleased I had it, and I hope you get an excellent result too.